Dr. Leeds.
Oh, hi, I'm sorry.
We're trying to interview you here.
I was catching up on some professional journals.
Well, we'd really like to know why your patients have been saying such great stuff about you.
Well, thank you. It's nice to be here. It's printed too small. The patients like coming back to me because, well, I've been doing this for over 25 years, and I'm just starting to get the hang of it.
Thank God.
No, I don't like, 25 years ago I decided I wasn't going to make this a boring old, which is better, one or two, here's your slip, take it out front. I want to make it interesting for the patients. A lot of times they come in after a bad day at work, and I try to get a smile out of them before they go. But, and also try to keep things on a professional level, because during the course of the exam I'll explain things as I go along. So they don't have a lot of questions at the end. Usually we try to go along and make them clear as to what type of exam they can expect. Well, we try to start from the beginning and go through a thorough testing procedure. Normally they'll get pre-tested with information that gets me a starting point. And I can use that to determine what type of exam I want to do based upon their case history and find out where we want to go with it, depending upon whether they want glasses, contact lenses, if they're coming in because of a problem they're experiencing.
What are usually some assumptions people have when they come in for their first eye exam with you, and what do they find out that might be surprising to them?
Well, usually when they come in, they're having a problem, you know, and we try to identify it and correct it as we go along. Sometimes they'll just complain about blur. A lot of times it'll be children looking to get their first pair of glasses. There is a state law in Illinois that says children beginning kindergarten now have to come in, so sometimes the best patients I get are the kids, because we get to have a lot of fun together, you know. They'll come in like this, and when they leave, they're like laughing, and we're having a great time. A couple of years ago, I had a young man come in who was having difficulty with a little bit of a blur, but no major complaints. And we ran a test called a visual field on them and found out that the lower half of his field was basically not seeing anything. And we referred him out, and it turns out the optic nerve on its way back to the brain passes through a pituitary gland. He had a benign tumor, was pressing up on it, so we had to send him out. And I found out later on they corrected a benign tumor through the nose. So when they came back, it seemed like his field was starting to return. So it's kind of interesting. You can try to find things you don't expect to see during the course of the exam.
What's some of the feedback you get from your patients after they get an eye exam from you?
Well, a lot of them say that I have a warped sense of humor, and I kind of like that. You know? I mean, if you get patients that come back to me for 10, 15 years, and they're sitting out there, and I greet them, the first thing I usually do is, who let you in? But they laugh because they know me. They realize that they're going to get an interesting eye examination from me. You know, I keep it professional. If there's something serious, I'll discuss it with them, but most of the time we try to have a good time. Okay. The things we have today that can help us to identify problems, work out, it's stuff that we never had in the past 5 or 10 years, which makes it easier for me to diagnose problems. As you can see behind me, I have the results of a digital retinal scan of my father's eyes. He suffers from high blood pressure, and I tend to notice that perhaps the veins are slightly enlarged compared to the arteries, but once we ran the visual field scan on him, it turned out there was no damage being done, so he did a very good job.
So is it always just good for safety's sake for people to, get their eyes checked regularly?
Well, the American Optometric Association recommends annual eye examinations regardless of whether you think you're having troubles or not, because many times problems don't show up. People could be seeing 20/20 and not realize that they have something going on, and that's why we need to check them. Well, we try to improve things along the lines of being able to see computers, because today the demographics, our patients are getting older, and they require help to see up close. And with the technology we have, with the prescriptions we can write, will allow them to see not just up close or far away, but at arm's length by using specific lenses. And even in the realm of contact lenses now, we're starting to get some bifocal contacts that are working wonders as well. Yeah, the type of work that you do without realizing it may cause a strain, whether you're a child or a youngster using a video game, or a young adult or an adult using a computer. We can identify problems that you may not realize you had, correct them, and make things easier for you on the job. When I'm working with young people, a lot of times now they're using things they didn't have years ago, video games, computers, and may have a problem that they may not realize exists, and we have to be able to identify it and correct it and make it easier for them to work. I mean, if we don't correct the problem at a young age, it can develop problems over time. Patients who have a blur at a very young age may actually continue to have that same blur as they get older. The earlier we can correct it, the better they'll be in the long term. Well, here we are in the office using some of the technology we have to determine how we can make people see better, like to check contact lenses with that. The old standby to get our glasses working over here. And this, along with some of the other technology, is what we like to use to provide a patient with a thorough eye examination, make certain that they're seeing well or better when they leave here, and identify any problems that we can try to correct. Okay. Well, to sit down in the chair, the first thing I'm going to do is go over their case history with them and find out what it is we need to take care of and see what problems they have. Even if they don't have a problem, sometimes we can identify it during the course of the examination, try to correct it as we go along, and then identify what their needs are and take care of them as we go. If they're looking to get glasses or contact lenses or need something treated, we can also provide that. Examination, length of examination depends upon the patient's problem when they come in. Some can be done very easily within a 10 to 15 minute span. Others require 20 to 25 minutes if they're coming in with some problems that need to be addressed.